Hi, my name is Caroline and my project focuses on communications in healthcare, more specifically improving access to medical interpreters. So before I start, I want to go over some key terms that are essential in understanding the project. The first one is medical interpreter, and this is a professional who provides language services to non-English speaking patients, and they mediate conversations with doctors, nurses, and other medical staff to ensure that both sides know what's going on. And LEP patient, this is an acronym for Limited English Proficiency patient, consists of individuals who are not fluent in English since it's not their first language. So to start off with the background, my parents and I are all Korean immigrants, and since we arrived after I was born, my parents had little knowledge of the English language. I always felt a language barrier in my family and naturally became responsible for interpreting and translating much of the bills, insurance papers, and pretty much any conversation that involved English. One of the most prominent interpreting experiences that I had was speaking for my parents in the hospital. We were not provided a medical interpreter and we were not aware of this resource. It was a lot more difficult for me to translate medical terms and diagnosis for my parents as well. As a result, I wanted to see if there was a way to bridge communication gaps in the healthcare system. So there are several federal mandates in place in protection of LEP patients. The most notable one is from the 1964 Civil Rights Act, Section 601, and this basically states that no person, regardless of their race or background, can be excluded or discriminated against from a program that receives federal financial assistance, and this discrimination includes judging someone based on their ability to speak or understand English. And despite this federal mandate, a lot of LEP patients are unaware of this protection and the resource that they can have access to since hospitals have not enforced the system. One major reason is because the mandate itself is very broad in scope since it consists of all government administration, and it's also not strictly implemented. So this has led to a series of consequences for both the patient and the hospital. So many doctors today often resort to a family member or friend to interpret their conversation. And not only does this bring stress to the individual who is mediating what is going on, but it can also lead to patient death. And this occurs when medical terms are not correctly translated and when the symptoms are inaccurately described. This happens a lot more than you expect, because last year there were more than 3,000 unexpected LEP patient deaths. In addition, hospitals often experience a budget loss due to unnecessary treatment and lawsuits. So some additional mandates and laws in place today to help alleviate the problem is the Executive Order 13166, and this reiterates the importance of having medical interpreters available, and this was implemented by President Clinton. In our state, the Illinois General Assembly made it a law to have medical interpreters available for all LEP patients who ask for one. And there are also several interpretation and translation groups who help both the doctors and the patient translate and interpret what is going on, and they work with anything from prescriptions to treatments to diagnosis. So for my research process, when I first started, I focused on a very broad scope, healthcare, and I wanted to see how we can make healthcare more affordable for immigrants and lower class citizens. I knew that it was a large topic, but I didn't realize how big it was until I actually started my research. And although our healthcare system is improving, it still has many gaps and shortcomings, especially for LEP patients. Therefore, I narrowed my focus to communications in healthcare. At first, I thought hospitals understood the entire issue with medical interpreters, and it was more of the patients who were unaware of the resource. Therefore, I thought it would make most sense to educate the LEP patients and build their confidence regarding communication aid. To investigate this hypothesis, I created and sent out surveys to all students in my school who spoke a different language at home. And the purpose of this was to analyze the extent of need for medical interpreters in my community and solidify possible solution methods. I also conducted 2 different interviews, one with an interpreter trainer at LARC, which stands for Language Access Resource Center in DuPage County, and a doctor who works at Loyola University Hospital. These interviews helped me understand 2 typically contrasting sides of the issue and additional information that the patients are not aware of. I also kept in close contact with my cousin in South Korea who is a nurse, and she helped me understand the healthcare system and translation system in place outside our nation. So these are some of the most notable results that I received on my survey. And the first 2 are not super overwhelming, as I've learned through my research that many LEP patients share a similar opinion. The first one asks, how often did you have an interpreter at a hospital when you needed one? And you can see the majority of people said never. And it was interesting to see this, as during one of my interviews with the doctor, I was told that there are some doctors and other medical staff who focus on seeing more people rather than the quality of the treatment and their time with the patient. So it kind of slowly made me realize that I should shift my focus more towards the entire spectrum instead of just the patient. And the second question asks if you prefer an online translating service or person-to-person, and you can see that a lot of people prefer person-to-person. And I felt that this result made sense, since speaking with someone directly is a lot easier to understand than speaking through a screen. And the last question truly helped me refocus my solution method, as it asks if the hospital staff told you had a right to interpreter services free of charge, and you can see the majority of people stated no. And it helped me understand that it's not just patients who are unaware of the issue, and it's hospital personnel who have to be educated as well. So to execute my solution plan, I created 2 different infographics. The one on the right is intended for LEP patients, and it explains the importance of medical interpreters, and I wanted to build their confidence in demanding for one, since they have a right to do so. And the one on the right is intended for doctors and hospital staff, and it explains why it's important to have this resource available for them. And in addition, I also translated the infographic in 2 different languages, for the one with the patients to Korean and Spanish. So I also created an actionable plan model for hospitals to follow and execute, and it basically covers the steps that they can take to have this resource available. As you can see, I explained the difference between a translator and a medical interpreter, screenshots of rules and laws that require them to have this resource available, and the steps that they can take to satisfy the communication aid that their LEP patients may want. So although I'm still tying up some loose ends, I look forward to staying in close contact with the hospitals and medical facilities, and I hope that my research and solution model will help erase the stigma around asking for communication aid.